In part one of our Benefits Behind Bars series, we showed you how much health care for inmates costs you, the taxpayer, how it is relatively cheaper for inmates to receive dental, medical, even mental health care while serving time. Tonight, we take a closer look at what local law enforcement calls one of the biggest issues in our county jails. News Channel 20's Alicia Lewis takes a look at the mental health crisis in part two of Benefits Behind Bars.
Medical costs are typically a big expense for most everyone's budget, and as taxpayers, we know our dollars are going towards housing, feeding, and clothing inmates while they're in jail. But those dollars are also paying for inmates' health care. While you spend hundreds of dollars to get an x-ray, it costs most inmates only $10. More than 783,000 taxpayer dollars were spent on health care for inmates here in Sangamon County last year. Turns out a similar situation is taking place in the Champaign County Jail, where nearly 600,000 taxpayer dollars were spent on health care for inmates there. And one of the biggest and most expensive problems county jails are seeing across the board, treating inmates who have a mental illness.
I need medical holding, please.
Mental health issues are the biggest problem, and it's a multifaceted problem because it's not just getting them the health care they need. They cause problems why they are in our custody.
I think that there's a very high level of those with mental illness or substance abuse that are getting arrested, and when they end up in the jail, we deal with them.
Local law enforcement officials can agree the problem in jails, inmates who have a mental illness.
We estimate probably about 20% of our inmates, and our head count's about 320 right now, have a serious mental health problem, and probably about 40 to 50% total have some form of mental health problems.
Sangamon County Undersheriff Jack Campbell says inmates who have a mental illness can be dangerous behind bars. Not only can they harm themselves, but also be a threat to other inmates and even deputies. But Champaign County Chief Deputy Alan Jones says it can lead to even more problems within the jail system, like overcrowding.
There are some that you can't house with others because of the state that they're in at the time. They need to be within isolation or segregation. There are others who are not violent, but they don't want to be with others. And then there's others who are sociopaths in some ways or another that are violent, and they require to be segregated.
Officials at the Champaign County Jail estimate about 75% of the inmates they receive have some sort of mental health issue. These inmates receive doctor visits, medication, and around-the-clock counseling, all paid by you, the taxpayer. Again, that is if the inmate is uninsured and has no funds available.
You got to remember that this is a correctional facility. It's not designed to be a medical facility. We found ourselves transitioning over the last 20 years from simply housing inmates to now providing all this medical care at taxpayers' expense.
State Attorney John Milheiser says the first step towards finding a solution begins with finding the difference between a correctional facility and a mental health facility and focus on incarcerating only the violent criminals.
We need to make sure we have room to lock those individuals up, and those nonviolent offenders with a mental illness, get them the treatment they need so they stay out of the criminal justice system.
Now, much like Sangamon County's current drug court process, which aims to get those nonviolent drug offenders out of the jail and into treatment, the county is looking to tackle the mental health crisis with a similar approach.
Shortly, we will start a mental health court, which is a team approach to deal with these individuals to make sure they get the treatment they need, they get the medication they need, which will keep them out of the jails and from committing crimes in our community.
Each county has the option of starting a mental health court. However, Janice Gambach of Mental Health Centers of Central Illinois says there are other options.
Crisis intervention teams and centers for people to go to instead of being incarcerated. They're also springing up across the country, and there's a committee here in Springfield looking at how we can set up a crisis intervention detox center.
Again, Mental Health Court aims to get the nonviolent criminals into treatment, making sure they're taking their medication and getting individuals with a mental illness back on their feet and out from behind bars. But who's paying for it?
That's the bazillion-dollar question. Who's going to pay for it? How's it going to be set up? Who's going to manage it?
We're hoping that the state of Illinois can solve this problem by maybe looking at reopening these facilities and finding a place for them to go, because they simply do not belong in jail.
Mental Health Centers of Central Illinois treated nearly 10,000 people last year alone diagnosed with a mental illness, many of whom had some sort of contact with law enforcement, which is why Gamback believes taxpayers will be the ones to pay.
The taxpayer will still pay for it, one way or the other. Human services and keeping those individuals in the community, helping them rebuild their lives, become productive members where they can work, actually in the long run saves the taxpayer money.
Many county jails across the country have a mental health court system in place, and according to a study published in the National Institutes of Health, they found that mental health court can reduce recidivism and violence by people with mental disorders who are involved in the criminal justice system. Vince?
Thank you, Alicia. Elsewhere in central Illinois, since 2009, the Macon County Jail has held mental health court. Macon County State's Attorney Jay Scott says they've seen a major improvement with those who suffer from mental illness. Scott says many no longer find themselves behind bars. Macon County originally received a grant to get its mental health court going, but in recent years, mental health court is funded through the county property tax that residents pay.